I am Dr. K. Mahadevan, Professor of Ophthalmology in Sri Gokulam Medical College, Trivandrum. I would like to give a short speech on some of the important points on this day. You all know that 1/3 of all the world's blindness is in India, and the common causes of blindness in India are cataract, glaucoma, refractive errors, and age-related retinal diseases. There are cures and treatments available for many diseases, but the easiest thing is to prevent the blindness. And as a first step towards prevention of blindness is to create an awareness of the various diseases that can cause blindness. In that category, we would like to emphasize on diabetes, on early detection of glaucoma by very regular checkup with the eye specialist, probably once in 2 years. And all children should have a checkup by the age of 3 years, 5 years, then every 2-3 years as the doctor advises to detect refractive errors, because refractive errors have to be corrected at the earliest and promptly, because that will affect scholastic ability of the children. Now, this year, 12th of October will be observed as the World Sight Day, and it's an international day of awareness, and it focuses mainly in India on cataract, because that is the largest number causing blindness. And cataract is very eminently a curable disease, but only thing is that the awareness should reach the rural areas and the poor masses and the uneducated people who may not be aware of these treatments available. And creating access to treatment also is a very important part of this blindness program. So the health awareness, the health treatment should go to the rural areas at the doorstep. And this can be done in many ways. As you all know, it is being done now. I would like to stress also on the early detection of refractive errors in children. And there are these children not only should get the refractive errors corrected, they should also be encouraged to play in the open for some time. Say at least 1 hour a day will go a long way to prevent myopia. Detecting diabetes is another part of the program, and every time a patient approaches the doctor for detecting blindness, he will also be advised on the proper diet, exercise that can probably help in controlling diabetes, in preventing the onset of diabetes at least, and also once diabetes occurs in the patient, proper diet and treatment can also delay the complications occurring due to diabetes, especially complications in the eye which can cause blindness, renal complications which can cause danger to life itself. For cataract, newer methods of surgery are available which help to rehabilitate the patient very fast without hospital admission, and you are all aware of that surgery called phacoemulsification, and with these we can increase the manpower output from these surgeries. They can be quickly rehabilitated and they can get back to their job fast. So that greatly enhances the output from every patient. And these cataract methods now available almost 100% successful with very little complications. And regarding diabetes, I would like to emphasize it is important to have the pregnant ladies also checked for diabetes, and those who already have diabetes should have their eyes checked every 3 months, because diabetes during pregnancy can aggravate the retinopathy, that is the involvement of the eye, and can cause problems. And also I would like to emphasize about refractive errors. The refractive errors cause great morbidity in the subjects, because those with high refractive errors may not be eligible for many jobs. Even though they have good vision with the correction, they are excluded from good jobs of their choice. So for that, we can even eliminate glasses with the latest treatments like LASIK treatment, which has greatly helped in our youth losing their jobs. They can go for the jobs of their choice, which is a great boon. So recent advancements in eye treatment and surgery should also be made aware to the public so that they will seek treatment at their earliest. Regarding glaucoma, glaucoma is a permanently blinding disease. So it is very important to detect glaucoma as early as possible before vision loss develops, because once it happens, it cannot be recovered. So very regular eye consultations with the doctor is very essential. And nowadays we have got very effective drugs also that can control this disease, and we need not have to resort to surgery all the time, as was the case before. And I would like to emphasize again the various gadgetry available now to detect glaucoma before the nerve gets affected. And therefore, people should be very conscious of this disease. The glaucoma develops so insidiously without any pain that they may not realize the disease until they have lost about 60% of their vision. And if there are drivers, they may cause accidents, and suddenly they may realize that this is because of the presence of glaucoma. So before a person reaches that stage, he should get his pressures checked whenever he goes to check his eyeglasses. So that he should demand that the pressures be checked, but usually all ophthalmologists are aware of it, and we routinely check the pressures of the eyes of every patient who comes for a glass checkup from the age of 40 years. So thank you for your patient listening. Thank you very much.